It's 2027. We are in the future of healthcare, a place where patient connections are working in tandem with care providers and healthcare services. Thanks to AI-enabled technology, patient services are moving at a rapid pace. Soon, patient service platforms will enable seamless integration, coordination, and resources that address individual patient needs and help predict their best management of care. Welcome to the Patient Engagement Revolution. Hi, I'm your host, Heidi Rataj, and I explore the dynamics of patient health and engagement. Today, we'll discuss how biopharma is using AI-powered analytics to improve the customer experience. We'll talk about how AI is also helping to streamline a crowded marketplace to create a scaled ecosystem that benefits everyone. Please welcome Sherilyn Tuthill. Sherilyn is the Principal and Practice Lead for Life Sciences Patient Engagement Transformation at Deloitte Consulting, and she'll give us some insight into what the future of patient engagement and services look like today and into the future. Welcome, Sherilyn.
Hello.
Sherilyn, let's get into it and start by talking about the future of patient services and engagement.
We named it Patient 2027 just because the intent was it's not 10 years away, it's not even 5 years away, but we need to be helping our clients to invest in the future vision now in order to be able to achieve it by 2027. So a couple key things that we see in terms of how patient engagement will look in 2 to 3 years from now would be really moving from a one-size-fits-all set of support services for patients and really moving towards more of a predictive, proactive, and personalized set of services that's driven by AI and machine learning to take enriched data on patients that we may already have and that we really understand about them in terms of their social determinants of health, their location, their behavior, their preferences, bringing that all together to deliver the right set of solutions and services for that particular patient. From an internal perspective for pharmaceutical companies, it's saying you don't have to offer every single thing to every single patient. From a cost perspective, you can really focus on patients that, based on data and analytics, you understand are at the highest risk and have the highest need for these really high-touch, high-value services.
So I want to expand on that a little bit, Sherilyn, and it sounds like there's two things, right? We started from a financial affordability of these complicated treatment regimens to the complication in and of itself. And I love that you've brought in sort of this idea of social determinants of health, right? We know in the healthcare ecosystem that often just getting to something or having someone there to be supportive of is sometimes the barrier or a barrier to really good, successful treatment regimen. Give me some examples of what is working now in patient engagement, and how are you expanding on that?
Yeah, absolutely. I think that one area where it has worked very well is in those very highly specialized treatments in rare disease. For example, a company that focuses very closely on one therapeutic area where they really understand that patient population. They are able to know the patients really well and have been very successful in forming relationships with those patients and helping them through the process and really staying engaged with them throughout that patient's entire life. I think where some of the expansion now is starting to happen is companies with more general medicines or, more primary care also want to be having relationships like that with their patients. So that's where when you start to think about, okay, before we were trying to engage or really understand a group of 30,000 patients, and now I want to understand 3 million patients, that's where we need to be able to scale some of the principles that were really employed in terms of engaging with patients in that high-touch, personalized way.
Let's imagine that I'm a patient in the 5-year horizon. What tools are you using to provide more personalized support and experiences that would help me have better clinical outcomes?
A couple ways I think that will look in several years. Number one would be as soon as you're getting prescribed that therapy, and I'm going to focus more on the post-prescription journey. Here we're talking about it from a biopharma lens. So certainly I think there will be other things that would impact how the patient is getting that initial care, understanding their diagnosis, a lot of that part of the journey, but kind of picking up after together with their doctor, they've come to the conclusion this is the right product for them. The ability to have kind of a choice and a balance of what I prefer and also what I need as I start that journey. So for example, if I am someone who is going to prefer more of a self-service, I'm comfortable interacting with a digital AI agent in order to confirm that, my benefits are going to be covering this therapy, and comfortable working through all of that via a live chat, or I'm comfortable doing that in more of a service way, that I can do that. However, if I also is someone who prefers more of a personal connection, that would still be available to me. And, I can really work with kind of a single point of contact in order to be able to get onto therapy, understand if I can afford it, get any training I might need, and then, importantly, stay on therapy over time. You asked about outcomes. I think it really is specific on different therapies, what outcomes they're trying to achieve. But in inpatient services, a couple are important. Number one being just the time to fill, from when you get that prescription to when you actually get it and can start taking it. But just to go back to closing out on the journey, I think as you mentioned, social determinants of health, a lot of our clients here and pharmaceutical companies have so much data available, but where we're really starting to connect it now is how can you take data about the patient's social determinants of health and right from the start match the patients with the service that they need. That's really going to make the most impact for them.
Yeah, Sherilyn, I'm really, really glad you brought that up because to your point, it's not one way, right? Understanding social determinants of health, if you have that feedback loop, it's also what it sounds like really meeting the patient where they are, but it's in context to understanding where the services are provided. To me, it really sounds like precision care that meets generational sort of appetite and expectations of healthcare. What's exciting about the understanding of what you're describing, where biopharma is going, is this idea or recognition that individual care means that you really have to understand the individual. And by understanding the individual, some who benefit from or need a personal conversation, some that have a digital comfortability, and probably mostly folks that are in the middle, right? This idea of like, where am I and how access can be delivered to me, that's a very exciting proposition. And it gets to that additional layer of social determinants of health and generational sort of expectations of healthcare. I mean, you know better than most of that it's very difficult, right, to be able to deliver to that elder care patient and also that millennial and that younger person. It's never the same, and the channels and conversations are quite different and varied. So that's what I thought was very interesting in what you were sharing.
Absolutely, yes. I think that's true. And not saying and I do think that there's a bit of, we don't want to stereotype as well based on someone's age necessarily, because I think, yes, like maybe 10 years ago, there was a lack of comfort in certain age groups. But I think we're really seeing that, based on patient's age, that is really only one factor of what they might prefer or be comfortable with. So that's where I think we can really rely on the power of data and machine learning and understanding to better predict what is the right channel and place for each patient.
Let's so shifting to AI, we're touching on that now from previous questions. AI technology is all the buzz right now. I mean, wherever you go, AI is touching our lives, whether you want it or not. What AI tools are hot buttons right now that you're seeing, and how are they shaping the future?
I would categorize the two categories in the area of patient engagement and patient services. One would be efficiency, and the second would be that hyper-personalization at scale for patients. So on the efficiency side, we're really talking a bit more about things that are behind the scenes, where over the years, delivering patient services has become pretty expensive because, as I mentioned, one way that a lot of companies were able to do a great job at delivering these types of services was by hiring a lot of people, making sure that you had a big staff of nurses and a call center who could talk to a patient on a personal level and help them understand things, or, connect the patient with a personal one-on-one navigator that's going to help them through the process. And from a patient experience aspect, that was awesome. But in terms of scaling that, as I mentioned, when you get to bigger patient populations, as well as just really making sure those, high cost, high value, highly skilled people spend their time on those patient relationships, on solving problems. What was happening was they were spending a lot of time on administrative tasks, on things in a system that may take a lot of work to do, manual steps. So that's one big area of just efficiency, being able to take the work out of the work and automate those type of tasks. The other would be equipping those type of folks with really real-time insights. So again, they're still talking to a patient, but instead of saying, I'll have to call you back to tell you what might be the fastest pharmacy for you to use, their system is in real time mining the data about patients with that specific insurance plan with, XYZ different factors and can serve up to that person in real time. Now you've solved that problem right there on the phone with the patient while you had them, and you don't have to call them back 3 more times to solve that problem. So that kind of a few different layers of efficiency is one big category. On the hyper-personalization at scale, as I call it, is the other area that we've been talking about with, okay, how can AI really make the experience for that patient specific based on predictive analytics, behavioral data, proactively engaging and intervening with the patient when, the model itself can say, hey, this patient is going to have a problem. They're going to, not be able to continue their medication, or they're going to miss this refill XYZ. I would say it's really the second half of the coin is moving to that predictive, proactive engagement.
Just to lean in from a predictive, proactive, part of AI-enabled technology, as you're describing, is to reinvent this patient journey. You've described focusing on some of these areas of the personalized engagement. Some of the others, too, that I'd love to hear how biopharma companies are investing in these tools is also thinking about these other areas of, the continuous learning that you've just touched on a little bit earlier. We can hear onboarding, efficiency, with adherence. Talk to me a little bit more about these tools that biopharma companies are investing in to meet this customized or personalized engagement.
So if I think about some of the steps of the journey for a patient after they get prescribed, first is just making sure that they'll have access to the medication, they'll have coverage, and really getting on that first dose or, whatever the mode of administration is. So their interesting tools are just these risk models that can more proactively predict, which patient is going to have an issue getting onto therapy based on, like we said, their location, how far they are from a doctor or a pharmacy, their payer plan combo, for example, the, social determinants of health, financial data, et cetera. So really being able to know right after the patient is prescribed what their likeliness to get onto therapy successfully is. Then we mentioned, that adherence journey as well. Okay, after that, how am I staying on therapy? I think there's lots of data on, if the patient doesn't make it through the first 90 days, the drop-off is significant. So really being able to use more data to predictively, intervene when we know that a patient is at risk of that. Another area, though, we talk a lot about the risk itself, but that's not really new technology. I think it's also now we're looking at how do you design the right intervention for that patient. We've done a lot of this sophisticated AI, modeling on the finding the patient at risk, but now what? Is just saying, okay, call that patient an extra time. Will that even make an impact? We really need to also train the models to use data to determine what's the right intervention, because maybe for one patient, an extra call isn't the right thing. And maybe it's not from their patient support coordinator, but it needs to be from the doctor themselves, or it's from their caregiver. I haven't talked as much today yet about the whole healthcare ecosystem and care coordination. It's important to even think about as a patient, I may have, yes, this program that my pharmaceutical company has offered to me, but I also may have my specialty pharmacy reaching out to me to try to help me stay on my medication. I have a portal that I'm logging into from my doctor's office. I have my health insurance company has a mobile app that I'm supposed to use to help track different health factors. So, that's one area where I think we're continuing to improve is remembering, that each of those stakeholders are not the only person in the patient's life.
I'm so glad you are talking and sharing, Sherilyn, with us about care coordination, because that was top of mind. You were finishing up your response to our earlier question about describing these key stages of the patient journey. Shifting now to our patient and patient focus. So you're basically taking us there, which is wonderful. How are patients benefiting then from receiving services from biopharma companies via these patient services you've mentioned in patient engagement programs? And what do you see as the most pivotal changes patients are likely to see?
In terms of patients, I think the key benefit that we always want to focus on is their health outcomes. Are they staying on therapy for the reason of achieving the best possible health outcomes? The additional things that companies offer are always in the context of, regulatory and compliance in terms of, things like a patient assistance program where they get access to free medication or, travel assistance. We, of course, want to be careful about how patients are receiving benefits from pharma companies, but all within the context of regulatory and compliance. I would say that an area that's really interesting is, some of our market access colleagues at Deloitte as well are focused a lot on innovative financial affordability options. A lot of the, financial assistance over the years, I think, has been maybe slower to progress than some other industries. How can we think about financing and things like that in a more innovative way in the healthcare industry as well? Also thinking about how affordability options can be more tiered based on patient needs. So we definitely have a lot of interesting work going on with different companies in that aspect.
This is such an interesting area, having worked in healthcare myself and thinking about the finances. The expression for a lot of patients is, I just want a financial calculator. I just want to know, what am I dealing with? And I find that patients too, and I don't know, Sherilyn, if you see that in your work, is the more transparency, and maybe that has become more of a cliche word, right? But the transparency, the journey, the steps to which I get from A to Z and understanding what I can prepare for. We've been thinking about it, we've been percolating about it, we've been talking to people about it, and so on. So to me, this is an interesting place to ask you now is, how do biopharma organizations work to gain patient trust? Because I think trust is going to be an important ingredient, obviously, to all of this. But as it relates to finances, I do think there's an interesting opportunity there. What do you think about that?
I think that's a big part of it. And Deloitte, we have a Center for Health Solutions, and we put out a lot of interesting research. And I had one tidbit here that, overall confidence in the medical system is down from about 80% to 34%. And more than half of consumers have a negative experience that made them lose trust in their overall healthcare journey. And that does also make people less likely to engage in preventative care, even though today we've been talking a little bit more about care post the diagnosis. But I think that's one aspect to keep in mind is where patients are starting from in terms of that perception. And one area that we really help our clients work through is just the governance framework of how they're going to adopt AI within their organization. And I think this is an area that we're really, encouraging our pharmaceutical clients to focus on. How do they invest in governance and transparency so that they're confident in how they can deploy these types of new AI technology in a trustworthy way. You mentioned the transparency, and I think that's really the other key in terms of having patients be aware of what their data is being used for. Certainly, we can all think of wondering how this company knows something about them when they've only just started engaging. So I think just the transparency and consent has been a huge part of this whole patient support area for years. And I think the consent language and transparency is a big part of it as well.
So what do you think are some of the other barriers biopharma has to work through to be successful in providing services to patients?
Some of them I am going to focus on are a little bit more internal, I'd say. We've been focusing a lot on what it means for patients externally, but a couple things for biopharmaceutical companies overall. Number one is, I think, balancing the cost. As I mentioned, we found that, yes, by staffing up big organizations of in-house, nurses who can really give one-on-one personal guidance and support to patients is very effective, and a lot of patients, benefit from that. But there is still kind of a cost aspect to it, and being able to do that in a way that the company can sustain. So I think, as I mentioned, as we look more to your bigger populations and primary care, especially with as many companies now that are, focusing on obesity with GLP-1s, et cetera. These are much broader patient populations. So figuring out how to deliver that personalized experience at scale, I think is one barrier. I think another is, depending on the size of the organization, how to implement AI. Several of our clients are taking more of a top-down approach of instituting an enterprise-wide, Gen AI Center of Excellence, where as a whole organization, they'll prioritize the use cases that they want to focus on from a Gen AI perspective. But that means kind of internally, you've got to get in line to have your use case prioritized. On the flip side of that is where that's not in place, then you have just a lot of different, pilots or areas where, people are taking the initiative to institute Gen AI, but then there's a little bit less of that governance or structure around it. So I think it's another barrier, is just figuring out that right balance of how do you institute or deploy these AI solutions in a systematic way with the right governance, but also not hindering being able to move fast, fail fast, be agile, and respond to these new technologies that are available.
Yeah, and I think sometimes that word disruptive is not always a welcome word in healthcare, right? I mean, there's this, and I think you're speaking to that, right, is that you can run the risk of a siloed ecosystem, and if you're focusing on one area. So I think governance is a really interesting and very important process by which you're consulting these companies. How do the services foreseen connect all of the patient needs while including patient teams, such as the caregivers, healthcare personnel, care coordinators, and field operations?
There's definitely, I would say, a bit of a way to go here on this area. As I mentioned, I think everyone in the ecosystem certainly acknowledges that the patient has a lot to deal with, has a lot of different, systems or tools being available to them. I think that there has been some good progress over the last several years, where I think there was a proliferation of digital tools for a while, about 5 years ago, where everyone wanted to offer a mobile app to a patient and wasn't really thinking about, well, what value is the patient going to get from this, and why would they use it in conjunction with all their other, options. So I think we are kind of now thinking of it from more of a patient-centric lens. However, it is still a little bit siloed, I'd say, across, the healthcare providers, payers, and biopharma. So one area within biopharma and connecting with healthcare more, I think, is looking at above brand partnerships when offering things to patients. Instead of it being for my specific drug, how can it be in a partnership with a patient advocacy group and something that would really benefit all patients who are, suffering from a specific condition. So I think that's one way where the solutions can go more across brand at the therapeutic area level. You mentioned caregivers as well. I think, in patient services, we really try to think of the patient and the caregiver almost interchangeably when you think about what tools are available. But by having things that are specific for the caregiver, just keeping in mind anytime you have something for a patient, that could be being used by their caregiver as well. But also taking into account things like the consent and the data sharing when you have the concept of caregiver or those other roles in the patient's ecosystem.
I'm so glad you brought up the consent side. I mean, just personally speaking, being a caregiver of an older person, just the privacy and data sharing and just getting on my mother's portal can be challenging in and of itself. And I appreciate, though, that what you're sharing is that these two are elements to which you're looking at the entire, pieces of the pie, right? That biopharma is not looking at one area, but in fact, the entire ecosystem. And I very much appreciate that caregivers is very much a part of those plans. Before we close this conversation, recap on the Robust Patient 2027 effort. What are some key takeaways that help give listeners confidence in its success?
I would take confidence in the aspect that every pharmaceutical company that I've talked to is totally aligned and bought into the vision of what the future of patient engagement will look like in, call it 2027. I always get asked why 2027. It's really not that it's arbitrary, but the point is that it's not 10 years away. It's not even 5 years away. We're talking about at this point when we, were thinking about our point of view on this, it was a year ago. So it's already been 1 year, and companies are really right now investing in and putting into place the roadmap that they need to get to achieve this vision by 2027. So, it's going to be fast, but it also requires, focus on it now. So I definitely take confidence in the, just buy into the vision that the future of patient engagement and services will be more proactive, more predictive, and also, just more tailored to the patients that will, the tools that they really need to be able to achieve their health outcomes. In terms of some other takeaways, I'll just highlight, to me, the two key areas that we talked about was how generative AI or machine learning can really impact, number one, efficiency for allowing those who interact with patients to focus on the really high value relationship aspect and less on the administrative pieces, and really get the interesting and proactive insights they need to have the best possible conversation with the patient while they have them. And the second area being that hyper-personalization at scale, to be able to bring together all the enriched data on a patient, from their social determinants of health, from their location, from their behaviors, from their preferences, to match them with only the services that really are going to be the most beneficial for them.
It feels very much like the future that I'm hearing, Sherilyn, is this hyper-personalized, which gets us back to practicing medicine. I love this idea that allowing patients to have and benefit from machine learning, from having the benefit of an AI adjunct enabled environment by which they can lean back into the patient, that high touch ability to really understand and listen and give full attention. I think that's a lovely future to which I would love to participate. What are your final thoughts, advice, or suggestions for biopharma companies when it comes to building better patient engagement services?
One area that is sometimes a barrier as well for our clients in terms of advice is being able to invest in the underlying capabilities needed to make this possible. Really does require pharmaceutical companies to heavily invest in their data infrastructure, in their, as I mentioned, governance of these type of solutions. And what we know from a lot of, internal workings of pharmaceutical companies is a lot of times things are budgeted at a brand or a product level. So it's hard to jointly invest in building out those capabilities. So I think, one piece of advice would be to really break through that maybe historic barrier of how data technology is funded within a pharmaceutical company, to make sure that that infrastructure is there so that all of the portfolio brands can really benefit from it.
Excellent. Sherilyn, thank you for joining me today. The future of patient engagement is moving fast, and I appreciate your time and your informative responses. Thank you so much.
Thank you, Heidi.